Still, same as this. Okay, so you have your femur have to roll all the way down to the foot. Okay, that was your L5. S1, Polonius longus and brevis. That's the probably most difficult muscle test that you're going to perform. Okay, uncross your leg. So the patient's foot, you have to grab the patient's ankle to give them a stabilization. You ask the patient to hold patient's foot this way. You're going to push the foot toward the medially and downward 45 degree down. So you're going to push from here, you're going to push toward this way. Okay, I'm going to push this down, don't let me do it, hold. Same thing, hold here and hold up. Hold. I'm going to push down toward here. Right, that's it. Okay, so 45 degree medially, inferiorly. That's a peroneus. Okay, Achilles, there's a tendon between liver 3, kidney 3 and UB60. There's a tendon, and you're going to hit the tendon with this. Okay, I usually like to hit with this. Okay. And when you hit the Achilles tendon, you better to gently lift the patient's foot up. Then the Achilles tendon will get tightened up, so easy to get a reflex. Okay, the patient's foot down, relax. You don't need to help me, just relax. So, oh, no. Let me lift it up. Okay, hold it, just relax. So when you lift it up, then this tendon will get tightened up. So you hit it, see it, you saw it? Patient foot goes down, right? So you gently lift this up and hit. If patient is not relaxed, then he loses the reflex. Oh, maybe he doesn't have it on this side. Okay, see? When he doesn't, even though he doesn't have reflex, it's not your fault. As long as you hit it, then it's fine. Okay? So, but don't hit until you get it. Okay? When you hit like two, 3 times, if you don't get it, and that's his problem, not your problem. Okay? And S1's dermatome. I know here it's not that clear. S1 dermatome is below the knee, along the UB channel. Exactly. Okay? S1 dermatome below the knee, along the UB channel. Okay? So all UB channel, so it's all of the back and go to the pinky toe. Okay? So he's exposed, but yeah, you also have to ask the patient, shoes and socks off. Okay, on both sides. Then instruction one more time. I'm going to do this. Compare the sensation both sides. If it's different, tell me which side sensitive than other side. Oh, this all the camera is around, so just stay there. Okay, so from the back of the leg, is this till but actually, when you stand in the center, you are able to do it, but because of the divide. Okay, so from the back along the UV channel, right? Yeah, middle of the back and along the pinky toe. As a patient, is this feel safe? Okay. Remember, don't forget to ask the patient. Okay, so you instruct the patient. I'm going to lift your leg up. If you have any pain, let me know. Okay, and then you lift it up. Okay, you have to put your hand on the knee. The reason being is that when you lift it up, patient tend to relax. Okay. Patient tend to bend the knee. Then you're gonna screw up the range of motion. Right? You're gonna screw up the degree. So patient's knee have to be straight. So to prevent the patient buckle the knee, you put your hand on the patient's knee. And then you gently push it down. Okay, so then slowly lift it up. Any pain? Any pain? Any pain? Okay, good. It's tight. Okay, here. Say yes.
Yes.
Okay, here. Positive. Okay, positive. Okay, that's SLR. Okay, then you're gonna perform progress, right? Then you're gonna lower this down. So I'm gonna lower this down. If your pain gets eases up, let me know. Okay, so then you're gonna lower it down.
Okay.
Okay. Then you grab the patient's foot, bring it up. Any pain?
Yeah.
Yeah, that's progress. Okay, so progress after you SLR, you have to instruct the patient. You lower it down until patient pain eases up. Then when patient pain is eased up, you dorsiflex the patient's foot. Okay? And then where SLR is same thing. You perform SLR on the non-painful side. So here, you put your hand on the patient's knee. I'm going to lift this up. Let me know when you have any pain. Any pain? Any pain?
Yes.
Okay, right. Okay? That's same test, right? Okay, 6, 7. Right? Can you lay on your stomach? And question 8, 9 is the same test. Right? What difference is positive, negative finding, right? Okay. So 8, 9, probably I will tell you which side that you have to performing on. So let's say a patient came in with a right side pain. Let's say left side pain because you got it there. Okay. For question 8, 9, you don't need to perform both sides. You just need to perform on painful side. But if you want to do that, if you want to perform non-painful side, it's fine. But remember, you have only 8 minutes. Okay? If you exceed your 8 minutes, you're gonna lose your point. Okay? So I'm gonna perform question 8 and 9. I'm gonna perform knockout test first. Knockout test. Knockout test. Knockout sign. Okay. So patient have pain on the left side, right? So you grab the patient. This is a passive movement again. The patient is not doing anything. You grab the patient's ankle. You bring the patient's foot to the hip. Okay. Any pain when I do this?
Yes.
Okay. That's a knockout. Okay. Femoral nerve traction test. When you look at the handout, it's patient have to lie on side, but I usually don't do that. You don't need to switch your patient's position. If you do that, you're gonna lose your time. Okay, so what you do? You usually grab patient's knee. Okay, and then you lift it up. Any pain when I do this?
Yes.
Okay, pain in the front?
Huh?
I don't know.
No.
Never mind. Okay, femoral nerve traction test. You grab patient's knee flexed, and you grab the patient's knee. You just need to lift the patient's leg up. Okay? Femoral nerve traction test. Okay? Can you stand up, please? And stand here. Look this way. Okay. Arms position. Okay. Adam's position, you have to instruct the patient. You have to tell me, or you can ask the patient, can naked, totally, top and bottom, or you just tell me that normally you're gonna ask the patient to wear the gown, open to the back, or you ask the patient take off the top and bottom. Fine. Okay. So, Adam's position, you ask the patient, can you spread your leg about shoulder width? And you watch. See, patient, this hand is close to the body. That's separate. You see this? This is lower, higher, and ear too, higher, lower. Okay. Okay, and when you look at it, from here to here is wider, from here to here is narrower. That means his spine is twisted. Anyway,